Congratulations! My name is Evelyn and I'm the manager of the postnatal unit, and I would like to welcome you here after the birth of your baby. We would love for you to use our new Danu suite, which was created especially for new mums to relax and have some quiet time with their baby day or night. This suite is named after the Celtic goddess Danu, who is considered the Great Mother of Ireland, representing knowledge, wisdom, nurture and strength. Danu represents how strong you women are and empowers mothers as they embrace on this new journey of motherhood. If during or after your stay you have any questions, we will be delighted to help, so please don't hesitate to contact any member of staff.
You put your cold water in first, you add your hot, you just check it with your elbow. If it's comfortable for your elbow, it's fine for the baby. It's about 36 degrees centigrade, the water temperature. You put your hand underneath the baby's head like that. You just took the baby under your elbow resting on your hip. Now I'm holding the baby in the same position and I'm going to wash the baby's hair. So just wash it nice and gently. This is a very good baby. And I'm going to come back onto my mat. And I'm going to lie the baby back down and I'm going to dry the baby's head well. Babies lose a lot of heat from their heads, so make sure that you dry the baby's head very well. Now, when you're lifting the baby into the bath, just turn the baby over on its side, over in this position. Just put one arm, your left arm, underneath the head and hold on to the left arm. And put your right arm underneath the bottom and hold on to the left leg. Now you see there is no way this baby's going to fall on me. I've got the head well supported with my arm here on the left and I've got a good grip of the baby. Now nice and gently you're going to let the baby into the bath. If the baby's enjoying it, of course, just leave them in for a little while. Babies are very used to water from being inside, so they love the sound of the water. I'm going to lift the baby out again. Now you see I'm lifting the baby out nice and gently. So you settle them down, give them a little cuddle. Settle them down, and then you're going to dry the baby off well. Don't forget areas where they can get sore if you leave them wet. All babies are quite fat in here, so get right in there under the chin, because if you leave areas wet, they're going to get red and sore. They're all get right onto the armpit here, where they're like that, and another areas get right onto the behind the knees and in the groin area. They're areas that can actually get sore if you leave them wet. So you make sure that you dry those areas off very well.
After your baby is born, the cord is clamped and you are left with a stump where the umbilical cord was.
Every time you change the baby's nappy, you check the cord stump to make sure it's not red, swollen or oozing. The cord will fall off itself after 5 to 15 days, so just keep it clean and dry and you don't need to worry about it. Just make sure the cord is clean, and if needed you can take cool boiled water. This means water that was previously boiled in the kettle and left to completely cool, and using a piece of cotton wool, gently clean around the base of the stump, and most importantly, dry the stump after you've cleaned it. When you change your baby's nappy, make sure to fold the nappy down underneath the stump to make sure it's not getting rubbed on.
If there is any oozing, redness or foul smell, contact your healthcare provider.
Congratulations if you've decided to breastfeed. This is the best start in life you can give your baby. Breast milk is unrivaled as the ideal food. Not only has it the perfect mix of nutrients, but also all of the infection-fighting antibodies your baby needs. However, like anything, breastfeeding is a skill that needs to be learned, but once it's established, it will give you great pleasure.
Breastfeeding is the very best start you can give your baby in life. It is a very special, unique formula, tailor-made for babies. It actually protects your baby against all known infections, particularly ear infections and chest infections, and also protects your baby against viruses. We now know that breast milk also helps develop your baby's nervous system. For you, breastfeeding is really good. It helps you build up a unique bond with your baby, because when you breastfeed, you release lots of lovely hormones that help and aid this bonding. It also helps you get your figure back, because you burn up 500 calories more per day when you breastfeed. And it has a great protection against ovarian cancer, breast cancer and osteoporosis.
While you're still pregnant and in the early days after the birth, your breasts begin to produce a substance called colostrum. This is extremely easy for your baby to digest, making it the perfect first food. The first hours after delivery is the ideal time to get started on your breastfeeding.
Breastfeeding on demand is recommended with breastfeeding. That doesn't mean leaving the baby asleep all day, particularly in the early days and weeks of breastfeeding. Babies should be woken up every 3 to 4 hours if they're not demanding feeding. However, breastfed babies can often feed much more frequently than that.
How your baby is attached to the breast is key to the success of breastfeeding. This is called latching on. When your baby is in position, wait until their mouth is open wide. You can tease it open by gently pressing the upper lip with your nipple. Bring your baby to your breast, the chin and lower lip first. Baby's mouth should cover all your nipple and about 1 inch of the brown circle, the areola, around your nipple. Your nipple should touch the roof of the baby's mouth with his tongue underneath. Once your baby has a good latch on, there'll be a period of quick suckling to get the milk flowing, and then rhythmic suckling. When your baby is properly attached to your breast, you'll notice that his mouth is wide open with a big mouthful of breast, and his top and bottom lip are curled out, like the letter K. His cheeks are full and rounded, and his chin is pressed into your breast. The suckling pattern changes from short sucks at the beginning to long, deep sucks with pauses.
There are many different ways to position and attach your baby, but there's some key principles. So I'm going to talk you through a number of different holds. The first thing I would say to mums is get yourself comfortable.
Finding a position that suits you and your baby is important for successful breastfeeding. Make sure you're comfortable and well supported. Use pillows or cushions if necessary. And whether you're sitting up or lying down, keep a drink close by, and most of all, relax.
There's some new research out on a new position for breastfeeding called biological nurturing, and this actually works very well in attaching a baby on a breast. In this position, the mother is not sitting up bolt right upright or lying down. She's semi-inclined and she's lying the baby on top of her body. And in this position, the baby actually self-attaches. This hold now, if you put the baby in what's called the crook of your arm, lying along your forearm, and position the baby with its tummy to mummy's tummy. We call it tummy to tummy. With the baby in a straight line, and if you tuck the baby's bum under your other breast, it makes for very good alignment. Then we encourage mothers in the early days of breastfeeding to support their breast with feeding. You can do this by going in onto the breast with a C hold. Now, mothers often instinctively go in with a V hold, but that'll actually make your nipple very sore. So if you support the breast in a C hold with the under finger well away from the areola, that will actually make a very good shape of the breast for your baby. It's tummy to tummy, it's nose opposite nipple, and it's a C hold on the breast, and when the baby opens its mouth, you bring the baby swiftly onto the breast. So we say bring the baby to the breast and not the breast to the baby. This will actually make for very good attachment. Another variation of this hold is actually something called the cross cradle hold, and a lot of new mums like to initiate this with breastfeeding because they feel they have a lot of control in the actual initiation of the latch. In this, it's similar to the first hold, except you're doing the C hold with your other hand, and you're holding the baby's back and neck with the baby in straight alignment again. So it's very important that you hold the baby's back and neck, and again you're supporting the breast in a C shape. And you're bringing the baby to the breast, waiting for the baby to make a large open mouth, and when it makes a large open mouth, you're swiftly bringing it onto the breast, and then you can put your arm around the baby like this and relax into a nice comfortable breastfeed. There's another hold you can use for breastfeeding called the rugby hold or the football hold. So in this hold you support the baby's back and neck, let the baby lie along your arm and tuck the baby underneath your breast. And in this position you use the same principles of nose opposite nipple and bring the baby to the breast with a wide open mouth. This is a very good position to use for babies, particularly twins. Another way of breastfeeding your baby is lying on your side with your baby tucked up beside you. A lot of mums breastfeed lying down in bed, particularly late during the night. With this, the mother lies on the bed with 2 pillows, usually her head on the pillow and her shoulders on the bed, and tucks her baby up beside her, nose opposite nipple. Again, it would be the same principles of bringing the baby swiftly onto the breast when the baby makes a wide open mouth. This is a really comfortable way to feed a baby. There are lots of good indicators that breastfeeding is going very well by looking at your baby's output. In the first couple of days, the babies have very little wet nappies, and ideally 1 wet nappy. Day 1, day 2, day 3, and when your milk comes in on day 5, the baby will normally have about 6 wet nappies in 24 hours. This is a really good indication the baby is breastfeeding well. Another very good indication is actually looking at the stools. And babies have meconium stools for the first day or 2. And they have a changing stool, which is usually black, green or brown, day 2, day 3, day 4. And when your milk comes in, a baby who's breastfeeding really well will have 3 to 4 yellow seedy stools in 24 hours. If your baby has these sort of stools, the baby is breastfeeding very well.
Your breastfeeding is going well when your baby is alert and waking for feeds, has a minimum of 5 or 6 wet nappies and 2 soiled nappies per day after the first week, has gained weight, sleeps and settles during the day, and is feeding comfortably and pain-free.
If a baby is not correctly latched on your breast, you won't see rounded cheeks, you'll see dimpled cheeks. You'll also see the baby doing very short little sucklings as opposed to long rhythmic sucklings, or you may see a lot of the areola. In that case, you also may feel a lot of discomfort feeding. So if that happens, it's very important to break the latch and start again. And the best way to do that is actually put your finger into the baby's mouth and let the baby actually suck on your finger and break the latch very gently. Signs that breastfeeding may not be going as well for you is if the baby is not wetting and dirtying its nappies. So particularly in the early days, if you look for urates in the nappy, which is pink staining, and if the baby is not passing sufficient wet and dirty nappies, it would be very good to contact a health professional to help you with your breastfeeding.
Infant formula can provide the correct nutrients for your baby, but cannot provide the protection against illness. As it can take some time before a newborn's immune system develops, all equipment must be washed well and sterilised before feeding.
It's very important to keep all equipment used for baby feeding thoroughly clean. It doesn't matter whether it's breast or bottle feeding, we're talking bottles, teats, breast pumps. They need to be washed thoroughly and then sterilised. This is to prevent babies getting infections.
There will be clear and detailed instructions on the packaging of the formula you use. Make sure you follow them precisely. To prepare a bottle feed, boil fresh tap water in a kettle. When it's boiled, leave it to cool in the kettle for 30 minutes, but no longer. Clean the work surface well and wash and dry your hands. Remove the lid from the steriliser and take out the bottle, the teat and the cap using tongs. Carefully pour the required amount of boiled water into the bottle. Using the clean scoop provided, add the exact amount of formula to the boiled water. Remember, adding too much or too little formula could make your baby sick. Reseal the packaging to protect it from germs and moisture. Screw the bottle lid tightly and shake well to mix the contents. To check the feed is not too hot, shake the bottle and place a drop of liquid on the inside of your wrist. It should feel lukewarm, not hot. To cool the feed down quickly, hold the bottle under cold running water or place it in a large bowl of cold water, making sure the water doesn't reach above the neck of the bottle. Your newborn will probably take between 2 and 4 ounces per feed during the first few weeks and will probably be hungry every 2 to 4 hours. This is only a guideline, and it's recommended to feed your baby whenever and as often as they look for food. Do not try and make your baby finish a bottle if they don't want to, and never reuse leftover milk once your baby finishes feeding.
There are hunger cues to look out for. Babies will stick out their tongue, they may pout their lips, they may put their hand in their mouths, they may eventually start crying, but don't let your baby cry too much before a feed because they can take in quite a lot of air, which can cause discomfort for them later on.
Okay, so traditionally when we're feeding babies, they're more in a flatter position like this and cuddled in, and when they're in this position the flow of the milk goes too fast into the baby. So when we're using paced bottle feeding, which is a way of controlling the flow of breast milk or formula so that the baby can feed at a more comfortable pace, we have the baby in a more upright position. So we have you up like this, yeah, and then we tickle the upper lip and we wait for the baby to gape and ask for the bottle. Yeah, do you want it? Yeah, like that, good girl. And initially we don't have the teat full. We wait for a few sucks and then tip it up so the bottle is at a much more horizontal angle than you traditionally feed a baby in. And this way we want the baby to slow down the flow of the feed going into them. So you let her have a few sucks. If she's gulping, we're going to tip it down, let her take a couple of breaths and then back up again and just watch the flow. Good. And slow it down again and take a breath and then back up again. So when we feed babies this way, it's much more comfortable for them. We used to think that babies had a preference or would get nipple confused. Now we understand that it's more about flow preference. So babies get used to a faster flow. So if we want a baby to go between breastfeeding and bottle feeding, it's important that we don't get the flow of the milk too fast. So this is a way of comfortably feeding a baby. It's also very good for babies who are just formula feeding or bottle feeding. Okay. People worry that babies take in too much air when you're feeding babies this way, but we all take in air when we're feeding. In this slow pace they can push some air out through their nose and they will burp after the feed. So we just sit them upright and wait for the burp to come. So when you're offering the bottle again you look for the gape and see, and if the baby is done, they won't accept the bottle again.
When babies feed, especially from a bottle, they take in air. They can also take in air if they cry before feeding. If the air isn't brought up, it can get trapped and cause discomfort later on. There are some common positions for winding, but use whatever suits you and your baby best. Try holding your baby, leaning against your shoulder and rubbing or patting their back. It's a good idea to put a towel or a cloth over your shoulder in case more than wind comes up. Another position is sitting your baby upright on your lap, supporting him under his chin and rubbing his back. Or lying your baby face down across your lap and gently rubbing or patting their back can also be a good way of bringing up wind.
When you take your baby home initially, babies don't know the difference between day and night, so they really will sleep and eat and sleep and eat. Newborn babies can sleep for almost 16 to 18 hours a day, so it takes a little while for them to get into their routine. Their tummy's small, so they need to feed frequently. It is important to get the right environment from the word go and to get routines in place, and it's terribly important to keep your baby in the bedroom with you, asleep in their own cot for the first 6 months of their lives. It's important to get the temperature of the room right for your baby. The temperature that's recommended is 16 to 20 degrees centigrade. Make sure your baby's not lying near, cot's not near a radiator, a window with the sun shining in. Just that they're comfortable but not overheated. And sometimes if the weather's colder, you may need extra blankets. If it's warmer, you can take a blanket off. The message really is, if it's comfortable for you, it's comfortable for your baby. If it's too hot or too cold for you, it's similar for your baby. It takes a little while for babies to get into a nice routine. This will come eventually, but initially you have to try and establish a nice routine. Feed your baby regularly during the day. Don't let babies go for longer than 4 hours during the day without a feed, particularly breastfeeding babies. Bottle-fed babies generally feed 3 to 4 hourly. Then during the night, when you're putting baby to bed, try and have a nice calm environment. It would be very nice if you could bath your baby before you last feed, because babies can sleep very well after a bath. Settle them down, nice calm voice, a little bit of baby massage if you can. And in the night time, when babies wake up in the night, keep everything dark and dull. No bright lights, no chat to the baby whatsoever. Just feed them, change them and put them down quickly. And soon baby will know the difference between day and night. But that can take a couple of weeks. It's very important that the baby is lying on a good firm mattress, back to sleep, feet to foot. Make sure there's no duvets, bumpers, pillows, nothing that can obstruct the baby's airway. A blanket should be at shoulder level, tucked well onto the mattress. And the blankets that we recommend are cotton cellular blankets. They're the only blankets that are really recommended for the first year of life. It's very important to sleep your baby safely, and the message is back to sleep, feet to foot position. And the reason for this is that the baby can't go down onto the blankets. The only way they can go is up. So it's terribly important to have them feet to foot, back to sleep. And this is also a reason why we don't suggest you sleep with your baby in your bed, because babies can roll under heavy warm duvet and can smother.
Hi, I'm Carolyn. I run the perinatal mental health services here in the Regional Hospital Mullingar. Pregnancy and birth are profoundly emotional experiences. Having a newborn baby is exhilarating, exhausting, and physically challenging. The sense of responsibility can be daunting, and the sense of inadequacy and guilt can be overwhelming. The baby blues are very common and considered normal. They usually begin on day 3 after your baby has been born. You may be more tearful and emotional than normal. You may feel irritable and isolated and lonely. These feelings are unpleasant, but usually pass between 1 and 2 weeks.
If the baby blues get worse or last for longer than 2 weeks, or if your mood becomes very low several months after your baby is born, you may have postnatal depression. It is thought that 10 to 15% of new mothers will develop postnatal depression, and it can last for months or even years if it is not treated. Your family and friends may notice that you have postnatal depression before you do. The signs and symptoms of postnatal depression include feeling sad, anxious, and alone. You may feel guilty, irritable, and angry. You may experience panic attacks. You may not enjoy being with people or even your baby. Other symptoms of postnatal depression include crying easily, feeling rejected by your baby, worrying a lot about your baby, loss of appetite, feeling inadequate, feeling tired all the time, and problems sleeping.
Get help from your GP or public health nurse if these symptoms last for more than 2 weeks. The most important thing you can do is ask for help.